Over the past few years, I've been thinking about how we can solve the problem of the explosion of chronic diseases, including diabetes, obesity, and heart disease, or if you like, diabesity. The World Health Organization regards obesity as one of the most serious global public health challenges of the 21st century. The UK has one of the highest levels of obesity in Western Europe. In Wales, a quarter of 4 and 5-year-olds are overweight or obese, and more than 1 in 10 are classified as obese. This gets worse into adulthood, with 6 in 10 adults as overweight or obese, and 1 in 4 obese. We know that more men than women are obese, and those from disadvantaged communities are more likely to be obese than those from more affluent communities. Being overweight has become the norm in Wales, and evidence suggests that as the population becomes larger, people find it harder to recognise what is a healthy weight. Obesity is the leading cause of several major conditions, including type 2 diabetes, cardiovascular disease, and some cancers, and is associated with orthopaedic problems, poor mental health, and depression. Recent estimates by the Cancer Research UK shows that obesity is the second greatest preventable cause of cancer after smoking. It is predicted that 25 years from now, that obesity will be the main cause of cancer in women if we continue with our current lifestyles. Children who are overweight or obese are at risk of poor health as adolescents and into adulthood, and 80% of people who are obese at 4 and 5 remain obese. There is a risk of psychological harm with childhood obesity, and having a high BMI is the leading contributor in Wales for increased years lived with a disability. More people in the world are overweight than starving for the first time ever, and overweight is a sign of poverty. The financial cost to the economy is considerable. Illness associated with obesity is projected to cost the Welsh NHS more than £465 million per year by 2050, with associated costs to society and the economy of £2.4 billion. Wales has the highest prevalence in the UK of diabetes, with more than 200 people in Wales living with diabetes. This is 8% of the population over the age of 17, and the numbers are rising each year. This is the first time over 200,000 people have been diagnosed with diabetes in Wales, and around 90% of people have type 2 diabetes. There are a further 580,000 people in Wales that are at risk of developing type 2 diabetes. This is the most devastating and fastest growing health crisis in Wales is facing, and if current trends continue, over 300,000 people in Wales could have diabetes by 2030. Diabetes costs the NHS in Wales approximately £500 million a year. This is 10% of the annual budget, and around 80% of this is spent on managing complications, that of which could be preventable. People who have a long-term condition are often isolated and lonely, and researchers link social isolation and loneliness to the higher risk of a variety of physical and mental health conditions, including high blood pressure, obesity, weakened immune systems, anxiety, depression, cognitive decline, Alzheimer's disease, and even death. Being lonely is equivalent to smoking 15 cigarettes a day. Physical inactivity is associated in 1 in 6 deaths in the UK and is estimated to cost the UK £7.4 billion annually. The UK population is around 20% less active than in the 1960s. If current trends continue, it'll be 35% less active by 2030. Many people don't realise that physical activity has significant health benefits and can help prevent and manage 20 chronic conditions and diseases, including some cancers, heart disease, type 2 diabetes, and depression. Around 1 in 3 and 1 in 2 women are not active enough for good health. So despite all this money being spent on chronic diseases in Wales, we still have some of the poorest health outcomes. If our traditional biomedical model or system, which is set up to treat disease and illness based on individuals' biology and genomics, really the answer to treat this pandemic of chronic disease? If we looked at this differently, most chronic diseases are a social disease. Can a gastric bypass cure diabetes as if you can cut out a bad lifestyle like a wart? Can you medicate out a bad diet, take a pill while you down a Big Mac and fries and a Coke? There is a non-pharmaceutical intervention that is available to almost all people in Wales: food and exercise. Food is not just calories. It can provide us with all the nutrients, hormones and proteins that can cure chronic disease. If you can eat yourself into a disease, can you eat yourself out of the disease? Is it possible to eradicate chronic disease? When people think about curing chronic disease, it is overwhelming. It's too big. This is not for the state or the NHS to cure. This is a local problem, a community problem. With little help from your friends, is it possible to change your health? We know that you're more likely to have obesity if your friends are obese than your parents. People need a tribe. Can we use the community to be the cure? This is exactly what the Saddleback Church did in America. The church had a congregation of over 30,000 people meeting in 5,000 small groups. The pastor, after baptizing 500 people, realized how large the congregation was getting and sought help and advice from a doctor. They devised the Daniel Plan. It was designed by medical professionals but delivered online, virtually and face-to-face by people with no clinical experience to small church groups. Over 15,000 people signed up and lost in total £250,000. A functional medicine approach and lifestyle intervention saw a change in people's behaviour due to peer support, the creation of social networks, and people reported a reduction in medication use, doctor and hospital visits, better energy, lower blood pressure. They changed people's biologies by a social intervention. COVID was viewed as an existential threat by the government and the population. However, it became clear fairly quickly that those of greatest risk were those with obesity, type 2 diabetes and heart disease, generally preventable conditions. Despite this link being widely publicised, people got fatter and there was a drop in activity levels during the first and the second wave of the pandemic. Why was this? It highlights the challenge we face that people, when faced with the possibility of dying if they caught COVID, couldn't be motivated to make even small changes. We managed to scare people enough to wear face masks by themselves in cars and underwater in swimming pools, but they weren't scared enough to stop eating donuts and go for a walk. This is an example of how the state can intervene with nudging and scaring people, but it can't deal with the complexity behind the choices that people make. You need a complex intervention for a complex problem. These needs are not being met by services that are organised around the principles of the biomedical model and a social intervention focused on better choices and improving health with less focus on treating disease is needed. During May and June 2020, there were early indications that people were developing long COVID symptoms, and we wondered in Cardiff if learning from our community neuro work and our development of the rehab model could be used to offer a service that focused on recovery of symptoms rather than diagnosis and over-medicalisation. If this could work for long COVID, could this approach work for other chronic health conditions? At the time, there was very strong demand from patient groups and some healthcare professionals, and there was a direct pressure brought to bear on Welsh Government to provide a top-down, biomedical, doctor-led diagnostic approach to solve this emerging syndrome and find a cure. What became apparent is that people are unique, and therefore long COVID manifests itself depending on people's dispositions. Therefore, this required an intervention that could match and adapt to this uniqueness. The use of group-based psychologically informed interventions with peer support enabled people to recover or adapt to live well with their symptoms. A social return on investment evaluation of the long COVID service in Cardiff Vale concluded that there was a return of £5.38 social value for every pound invested. This approach and philosophy works and could be expanded to many chronic conditions, with the opportunity to scale up the delivery of psychologically formed interventions to educate, to support self-management and behavioural change, and to help people make good choices to live well. The community cure is in the magic of the group. We just need to be brave enough to do more of it.